I'll ask you one more question because I bet we're going to get this question from the audience. Keep your questions coming at the end. I kind of preface that we're going to talk about this a little bit, so I'm going to go ahead and go into it. Photons versus protons in non-small cell lung cancer. What do we
Totally.
do? How do you decide? Talk us through it.
Yeah. So, I mean, here's the thing. I had a graduate research assistantship at Georgia Tech for medical physics, and I did my research in proton therapy. So, designed a passively scattered nozzle, so the older school types of protons, based on the Harvard nozzle, the Gottschalk nozzle. There's a 100-page input deck of calculating secondary neutron dose. Really nerdy stuff. I say radiation oncology is the perfect blend of nerd skills and empathy. But I walked away a little bit disheartened because I really wasn't convinced that it was applicable in all scenarios. However, on paper, they look fantastic. And
Mm.
so it really depends on the patient. And also, I think the main advantage is affecting less of the white blood cells, especially in the immunotherapy era. So when we have bigger lengths of fields that we're treating, especially in curative settings, where maybe the tumor is more, involving more the lungs, such as around lymph nodes around the heart and like a lower lobe tumor, that means you're treating a lot of the lung from top to bottom. In those scenarios, the advantages of protons is they stop in the tissue and you're exposing less of the circulating blood to radiation. So if there's niche scenarios where I think it benefits, and we call that lymphopenia, right? And so that's lower white blood cell counts. We kind of don't want to knock out the white blood cells, especially in the immunotherapy era. So I do think there are niche uses. Perhaps in the metastatic setting, though, maybe not as much for non-small cell lung cancer. Actually, the data that we have might suggest increased or less safety, more pneumonitis with protons. However, that's old school protons, not the new school protons. In 2013, in 2010, there's only 13 proton therapy centers in the United States. Now I think there's over 50, and there's
Wow.
more advanced proton technology. And also the sunk costs are a lot less. So two-thirds of Americans don't have access to protons. So I think access is a huge thing, but photons have also come a long way. And so I think access is key. There are some advantages, but in reality, at Ohio State, for example, I'm sending my young adults over there with Hodgkin's lymphoma, and the wait list is 3 to 4 months. So
Wow.
you have to think of the advertising too. They used to cost $250 million to build. Wow, right? So we have to recoup those costs, but now they're 30 to 50 million dollars. I think in 10 years, that might come down to the single digit millions, and then we'll have more access. So it's a complicated thing. And modern photons are fantastic. And the numbers I was quoting for safety and efficacy were with photons. So sorry,
Mm.
I couldn't give a concise answer there. It's a really complex topic. And MD Anderson, a lot of the work they're doing there, Stephen Frank, for example, that randomized controlled trial for esophageal cancer was recently published. So there's a lot of fantastic work happening, but it's complicated.
Yeah, thanks, Dr. Reichman. I asked you two really tough questions.